Today we have to discuss about the topic is diseases of bones and joints in Paget's diseases. First of all, we have learn some more basics. The basics are what is the role of vitamin D and what is parathyroid hormones, what is the rank L and what is osteoclast, what is osteoblast. Whenever the blood calcium level is decreased, the parathyroid stimulate that parathyroid hormone. That parathyroid hormone stimulate that osteoblast. These osteoblast synthesis that interleukin 6. This interleukin 6 stimulate the another osteoblast. Those osteoblasts are synthesis that rank L and OPG. The role of rank L is stimulate the precursor of the osteoclast. That osteoclasts are grouped together to form a large osteoclast. That osteoclast helps play the resorption of the bones, and the rank L was controlled by the OPG that was synthesized by that osteoblast. Generally, naturally, that the osteoblast activities are slower than that osteoclast activity. So, in Paget's disease, it is very more prominent. It is called as a osteoclastic diseases. Introduction, whatever that it was named by Sir James Pagets. It is a chronic progressive disease of bones. It is commonly in middle-aged and elderly patients. This involves multiple bone that is called as polyostotic or rarely single bone that is known as monostotic. It is characterized by abnormal excessive remodeling. Initially, these osteoclastic activities are very higher. Then later, the osteoblastic act followed by the osteoblastic activities are getting remodeling, that new bones are formed. These bones are very highly vascularized and enlarged and weakened, deformed. So it is called as a primary disease of osteoclast. This is due to the sensitivity of the rank L and vitamin D and interleukin 6. First of all, the parathyroid hormone stimulate that osteoblasts. These osteoblasts synthesis that interleukin 6. These interleukin 6 are stimulate another osteoblast. The osteoblast secreted rank L. The rank L was stimulated the osteoclastic activity, precursor of the osteoclastic activity. That osteoclastic activity are grouped together to form a osteoclast. In this area, there is very any sensitivity in those like interleukin 6 or rank L's or parathyroid hormone or vitamin D. They are sensitive to those stimulus. These are osteoblast and osteoclastic activity. Both are very higher, but naturally the osteoclastic activity are more higher than osteoblastic activity. So osteoclastic activities are more. So it is leads to a Paget's disease. The etiology is unknown. Sometimes say that is a genetic link, this is family diseases. It is also a phenotype, autosomal dominant inheritance. Autosomal dominant inheritance means a pair of chromosome, that is one chromosome gets mutated, that leads to autosomal dominance. Also say it is a viral inoculations of the especially that paramyxovirus and canine distemper virus and measles virus. These viruses are get included into the osteoclast that stimulate the osteoclastic activity. Nowadays, these proposals are not accepted. Clinic features, probably 50 years of or 50 years individuals are mostly affected. Below less than that, rarely that 20 years individuals are affected. Men and women both are affected. Those diseases are found in the countries like England, France, Germany, and European countries, Africa, and Middle East, Far East. Although it is asymptomatic, some patients show symptoms like bone pain, bone deformity, and neurological musculoskeletal and cardiovascular anomalies. Why is cardiovascular anomalies? The cardiovascular anomalies due to increase in the osteoclastic activity leads to that increase in the blood calcium level that leads to osteoclastic activity, and neurological and musculoskeletons leads to that same things also. It is a predilection for it is most commonly seen in that skull, spine, and pelvis, and femur and tibia. These bones are most commonly affected in these areas. That commonly affected bones are become bowed. That bowed bones are seen in those patients. Affected bones exam deformed and the skull leads to a frontal bowsing. Why the skull leads to this like a frontal bowsing? Sometimes the base of the cranials became very softened, so it is very descendant to the towards the cervical spine. So this leads to a platybasia. This is normal bone. This is so platybasia. See this like conditions. Uh, Oral manifestations, both jaws are involved, but slightly involved. Maxillar activities are slightly involved in this area. That alveolar ridge is very broad. So in this alveolar ridge are very broad. The hard parts are get flattened. At the same time, the teeth become day by day more spaced. At the same time, the spacing leads to that denture becomes very tightening. So it is to avoid the ready-made dentures are made for those patients to avoid the denture tightening. This is used because of the migration of the teeth. Radiographic features, it is classified into three phases. One is osteoclastic phases, another is mixed phases, another is osteoblastic phases. These osteoclastic phases leads to bone resorption. The mixed phases combinations of phase of resorption plus new bone formations. The osteoblastic leads to more bone formations. In the early lytic phases, the osteoclastic phases, destructive radiolutions are seen. This like destructive radiolutions are seen in this area. Particular area get osteoclastic activities are done. This area in the especially in the skull, this is called as osteoporosis circumscripta. At the same time, it is very diffused and singular multiples. In these mixed phases, it is very radiolucency like this radiolucency. It is very look like a cotton wool appearances. So it isn't. Cotton wool appearances are very patchy. And the osteoblastic phases, the radiography are patchy in distributions like this. This like patchy distributions are seen in those radiographs. Other features are bone enlargement, cortical thickening like this. This cortical area became thickening and the bone became enlarged. Sometimes the lamina dura also lost due to the decalcifications. The lamina dura also, or sometimes hypercementosis will be seen. This like the hypercementosis in this radiograph, but this only hypercementosis are seen. This is the lamina dura are not seen. It is very. I take those pictures are for only hypercementosis how look like. So not it is a Paget's radiograph. It is hypercementosis radiograph. Histology features, the osteolytic stages are seen. This extensive resorption of bone increase in osteoclastic activities are increase in those areas. For that we will see that multinucleated giant cells are regard to seen. These multinucleated giant cells are formed because of the previously we talked about that osteoclastic precursor of the osteoclast. That precursor of osteoclast are joined together to form a large osteoclast. That osteoclast is this is normally larger than usual. So the osteoclastic activities are higher, and we have to see some more relative fibrous tissues and it is highly vascularized. These areas are very highly vascular. These patterns are arranged in zigzag patterns and mosaic patterns is highly vascular and filled with the fibrous tissues. This treatment is there is no specific treatment for not to avoid the pain. We have to use the NSAID aspirins are used to avoid those pains. Bisphosphonates are also used. Why bisphosphonates are used? Because of bisphosphonates helps to prevent the osteoclastic activity. So most potent bisphosphonates are used to prevent that osteoclastic activity, and calcitonin is also used. The calcitonin is stimulate that osteoblast, so calcitonin are used. Sometimes the Pagets disease leads to stress fractures and secondary sarcomas.